Crown forums we have had this semester, I did and thank you for obedience, because obedience is indeed better than sacrifice. Oh yes, thank you very much, men of Morehouse. And we will now have prayer by Mr. Sigan Idawu, class of 2012. Don't want to go back there, do we? Chapel Assistant, Martin Luther King Jr. International Chapel.
Good morning. Let us go to God in conversation. If it had not been, where would we be? If it had not been for the grace of God, we would not have made it to this point of the semester. If it had not been for the Lord on our side, we may not even be here at Morehouse College. And so before we as freshmen vent about the hardships of the adjustment process, we say thank you. Before we as sophomores bring our frustrations to the table, we say thank you. Before we as juniors lament our junioritis, we say thank you. Before we as seniors express our stress over audits, fees, and grades, we say thank you. We are coming to the end of the first for some, last for others, and just another fall semester for everyone else. As another season of our collegiate experience draws to a close, we long for something a 5-hour energy drink can't give us, something late night snacks can't deliver, and that is focus in our studies, calm for the quiet storms we create in our minds, and confidence in our own worth and ability to do the work and end stronger than we began. Remind us that this struggle is not for nothing, that in the end, it is not merely the degree that we suffer for these 4 years, but it is your people, the troubles of this world, that we are being shaped and molded and prepared by you to confront and repair. Open our eyes to how we daily mistreat and defile this temple of ours. Give us weak eyes for fast food and clear eyes for real food. Help us to begin to maintain healthy diets so that we can build up the strength necessary for all-nighters and for a long life. After Thanksgiving, we know that you are already within us and that we already have the power to fulfill these desires, because with you, through you, and by you, all things are possible. And so it is, and so it shall be. Amen.
Thank you, Mr. Idawu. To President Franklin and other members of the dais, to men of Morehouse, and ladies and gentlemen, new knowledge in the field of healthcare is ever available and ever changing. Unlike your grandparents for many of you, and even your parents for some of you, you are benefactors of valuable information that will improve the quality of your life and lengthen your years on this earth. Yet, as available as is this information, we still need an expert. We need one who is exceptionally well prepared on a number of aspects of the subject of disease prevention and health care to present information to us in a manner that will raise our consciousness to a higher level of clarity and sensitivity for meaningful action. No Morehouse College education is complete without knowledge of behaviors leading to physical, mental, and social well-being. Under President Franklin's leadership, there is a renewed commitment and a more concerted effort to increase the number of students going into the medical field in general, but also to revitalize the face of the Thomas J. Blocker program in particular. And this is a program that for many, many years was successful in recruiting and preparing men of Morehouse College who became Morehouse men and later successful as practitioners in various fields of health care. In fact, it was the late Dr. Thomas J. Blocker who continued, he was the first, and who continued to bring to Morehouse College over and over again in seminars and workshops, but also in Crown Forum, our speaker for the morning. Yes, knowledge is power. And today's program is designed to empower you to do three things. Number one, to seek. To continue to seek information on preventive measures for sustained good health in your lives and in the lives of members of your family. Number two, to act. To act immediately when health care is needed for yourself without hesitation or excuse. And number three, to practice. To practice behaviors that lead to the prevention of common chronic illnesses. In the words of Robert Ingersoll, if we had our way, we would make health catching instead of disease. Today's program is a step in that direction. Ladies and gentlemen, this is the occasion. We will now have a solo by Mr. Xavier Durden, member of the class of 2014. He is a tenor in the Morehouse College Glee Club. Didn't It Rain, arranged by U.Z. Brown, Jr., after which the program will proceed as printed. Thank you.
Dr. Watts, Brother Idowu, Brother Durden, thank you, and Dr. Oliver, for your service to our programs always. As I stand to introduce today's Crown Forum speaker, we welcome a son of Morehouse back to the House. But as I reflected on his life and his labors, particularly during his time in the Beltway in Washington, the challenges and conflicts he faced, and the victories he claimed, his life and his work inspired one of those Morehouse mentoring moments for me, where he has been a mentor to me. And I offer this word, again, inspired by Dr. Satcher's life, to each of you gentlemen who gather. In Scripture, there is a passage, Isaiah 54:17. You should know of it. It simply says, "No weapon formed against you will prosper." No weapon formed against you will prosper. And yet, even those who go forth as disciples of nonviolence still carry weapons. But they are of an unusual sort. Just look at the life of Dr. King, of Julian Bond, of Amos Brown, of David Satcher. Part of what they carried with them as weapons is the gift of the Morehouse mystique. Two simple things in my way of thinking. One, always show up with the weapon of your dignity, manners, a simple smile, your presence. Because of stereotypes about who we are, people expect us not to be dignified and pleasant and mannerable. When you do that, you carry a weapon. The second is the weapon of the five wells. In a strange way, when you show up well-read, well-spoken, well-traveled, well-dressed, and well-balanced, you disarm your opposition and those who do not believe or hold high standards before you. And so our speaker comes today as one who has borne those weapons and done well. Born in Anniston, Alabama, Dr. David Satcher earned an MD degree as well as a PhD from Case Western Reserve University in Ohio. He's widely acclaimed worldwide for his commitment to eradicating public health disparities among minorities. And we are pleased that following several noteworthy positions, he came home to the Morehouse School of Medicine, where he established the Satcher Health Leadership Institute in 2006. Dr. Satcher graduated from this college, Morehouse Phi Beta Kappa, and throughout his career, he's demonstrated what it means to be a Morehouse Renaissance man. He completed his residency and fellowship training at Strong Memorial Hospital at the University of Rochester, UCLA, and King Drew. He is a fellow of the American Academy of Family Physicians, the American College of Preventive Medicine, the American College of Physicians, and the American Psychiatric Association. From 1982 to 1993, Dr. Satcher gave leadership as the president of Meharry Medical College in Nashville. From 1993 to 1998, he was the director of the Centers for Disease Control and Prevention and administrator of the Agency for Toxic Substances and Disease Registry. In 1998, President Bill Clinton appointed Dr. Satcher the 16th Surgeon General of the United States, where he focused on issues that had not previously been addressed at a national level. Simultaneously, he served as Assistant Secretary of Health and Human Services at the U.S. Department of HHS. He served as president of the Morehouse School of Medicine from 2004 to 2006. Dr. Satcher is the recipient of more than 30 honorary degrees and has earned top awards, and they are too numerous to mention. Please join me now in extending a warm welcome to this son of Morehouse, Dr. David Satcher, our Crown Forum speaker.
Thank you. Thank you very much, President Franklin, for that very kind introduction. And thank you for such a warm reception. Dr. Watts and Dean Carter, my student colleagues on the podium, and to all of you men of Morehouse, ladies and gentlemen. I'm really delighted to be here. It's great to be back, even though I only had to come across the street. It's great to be back at Morehouse College, where I have so many memories. I bring you greetings from the Satcher Health Leadership Institute at the Morehouse School of Medicine. And I want to just say a word about our institute. You may say this is my only commercial, but the Satcher Health Leadership Institute has a mission that's related to the elimination of disparities in health. Our mission is to develop a new generation of leaders in medicine and public health who are committed to the elimination of disparities in health. And we do that in the context of providing leadership ourselves in the elimination of disparities in health. Our philosophy is similar to the Institute of Medicine's declaration that the need for leaders in medicine and public health is too great for us to leave their emergence to chance alone. So we believe that we have to play that role. Our leadership experience for our fellows and community health leaders and students is one in which we are all learners. We're all students. I think it was John F. Kennedy who said, when leaders stop learning, they stop leading. So our philosophy is that everybody teaches and everybody learns. And we have learned a lot, for example, from people who come from the community, who live in the community, and who spend 12 weeks with us 1 day a week, and studying leadership strategies, and we learn a lot from them, and hopefully they learn from us. So if you ever get an opportunity to have an experience in our Leadership Institute, I hope that you will take it. Let me have a minute of reflection because I think it helps me to put in perspective the issue that we're discussing this morning. And my specific topic is the role of ethical leadership in the elimination of disparities in health. I graduated from Morehouse College almost 50 years ago. In fact, my classmates and I are getting together to plan our 50th reunion in 1913. So we're very excited about that. I came to Morehouse from Anniston, Alabama in 1959. It was not easy for me to get into Morehouse. They had never heard of the Calhoun County Training School and were not quite sure what that was about. But it was a high school, but they expected those of us who attended to be farmers or carpenters at the most. So it was called the Calhoun County Training School. And of course, nobody from my family had graduated from Morehouse. But finally, Morehouse made me an offer that if I came and kept a B average, that I would have a scholarship and I would always be able to get a job to pay room and board. So I came, and Morehouse kept his promise to me in so many ways. Now, my motivation to go into medicine started long before I came to Morehouse. When I was 2 years old, I had a bout with the whooping cough, pertussis, and it turned into pneumonia. We didn't have access to health care. We lived on a farm, about a 44-acre farm, and my parents had really lost a child a year before. So my dad went to town looking for a doctor, and there was one black physician in Anniston, Dr. Jackson. And Dr. Jackson agreed to come out to the farm to see me on his off day, when most physicians are playing golf. He decided to come out to the farm and see me. And he spent all day, according to the story, all day working with me. But when he left, he told my parents that he did not expect me to live out the week. And now, my mother told me that story many times. And so by the time I was 5 years old, I obviously survived, the one thing I wanted to do was to go meet Dr. Jackson. So my parents promised me that for my 6th birthday, they were going to take me to town to meet Dr. Jackson. I never met him. Dr. Jackson died that year. He was 54 years old, and he died of a stroke. I mean, you must imagine what it must have been like to be the only black physician in Anderson, Alabama, and not have admitting privilege to the hospital as a black physician. He worked under a lot of stress, and at the age of 54, he died of a stroke. Well, by the time I was 6, I was telling everybody that I was going to be a doctor, just like Dr. Jackson. Now, it is true that I really didn't know what I was talking about. I didn't know what it took to be a doctor. No one in my family had been to college. But I was as sure of that as I have been of anything in my life, that I was going to be a doctor. And I was also very appreciative of the model that Dr. Jackson had set for me. So I came to Morehouse with a passion for medicine, but the experience that I had at Morehouse, I think, changed me tremendously in terms of the way I viewed medicine. As a student at Morehouse, of course, in the classroom, in the chapel, I heard great speeches, I was motivated, and leadership was an issue that was always before us. I became involved in the student sit-in movement and went to jail and even to prison on one occasion, but I also had an opportunity to work with people like Marion Wright Ellerman and Otis Moss and A.D. King and others. And a group of us every Sunday morning would walk the 3 miles or so to Ebenezer when we know that Dr. Martin Luther King Jr. was speaking. So I tell people that I went to medical school with an attitude. And my attitude was that it was not enough for me just to finish medical school and practice medicine. I was expected to be a leader. I was expected to help to make medicine better than I found it. Well, the health system in 1963, when I graduated, was not the same as it is today. The life expectancy for black men was just above 60 years of age. In other words, the average black man would not live to see retirement at age 65. There was no Medicaid or Medicare, Medicaid for the poor or Medicare for the elderly. That was to come later. Black physicians were not allowed to practice in many, perhaps most of the hospitals in the South. That would come with the Hill-Burton Act, which was associated with Medicaid and Medicare. So things were different. There were only 2 predominantly black medical schools, and that was Meharry Medical College and Howard, and they together had graduated most of the black physicians and dentists in this country. No, there had never been a black director of the CDC or Surgeon General or Secretary of Health. That would come later, and Morehouse men would be a major part of that. The life expectancy was not going up rapidly. So that was the context in which I went to medical school. Now, it's interesting because today we have a lot of challenges, but I wanted to make sure that you put those challenges in perspective. We have come a long ways. We have a long ways to go. But it's really important for you to understand that we can make a difference, we have made a difference, and we need to continue to make a difference. So what is health care like today in the days of Medicaid and Medicare? Well, I think you know that there are more than 50 million Americans who are uninsured as we speak. Virtually all schools of medicine, nursing, and dentistry have an underrepresentation of African Americans. Less than 6% of medical students are African Americans. That has not increased a lot in the last 10 to 15 years, and we're very concerned about the fact that we made some progress in the late 80s and early 90s in increasing the enrollment of African Americans in the health profession schools, but we haven't made a lot of progress since that time. Our healthcare system is well integrated, including our hospitals and clinics, and yet our health system is really, in many ways, bankrupt. Not only do we have 50 million people who are uninsured, there are at least half that number of people who are underinsured. They may be insured, but they may not have insurance that covers mental health or dental health. They're underinsured. They may be dropped from their insurance after they've accumulated a certain level of debt. And those people may have diabetes or cancer, and every day people get letters from an insurance company telling them that they are no longer eligible for insurance. We spend a lot of money in our health system, more than any other country in the world. Last year, we spent over $2.5 trillion on health care in America. That's more than $8,000 per capita. And yet, when you compare outcomes in this country with outcomes in other countries throughout the world, and I've spent a lot of time working with the World Health Organization, we rank about number 43 when it comes to health outcomes. When it comes to infant mortality, the risk that a baby will die in the first year of life, we rank between number 25 and 30, actually below Costa Rica and Cuba. So obviously there's something wrong with this picture in terms of access, in terms of cost, in terms of quality. And then, of course, we have major disparities in health outcomes. We have major disparities in areas such as infant mortality, where a black baby is 2.5 times more likely to die in the first year of life, where in terms of cardiovascular death, African American men are 35 to 40% more likely to die of cardiovascular disease each year. And interestingly enough, in the area of cancer, and by the way, cancer is the leading cause of death for people under 75 years of age in this country, cancer. And in all of the 4 leading causes of death of cancer, lung, colon, prostate, breast, we have the highest mortality rate. Well, I didn't come here to depress you by telling you how tough things are. They're much better than they used to be. African American men now have a life expectancy of about 71 to 72 years, about 5 years less than for white men. African American women now have a life expectancy of about 77, about 3 years. They've really made a lot of progress in closing the gap, and it has a lot to do with the socioeconomic status and education, which we have to deal with. So what is the role of ethical leadership in changing this picture? Well, recently, Walter Fluker, who is now, I guess, the Martin Luther King Chair at Boston University, who was head of the Leadership Center here, wrote a book called The 3 Dimensions of Ethical Leadership. And it's easy to relate those 3 dimensions to what I think we need to do in terms of our health system. The first dimension is integrity. It's how we deal with ourselves, whether we are trustworthy, whether people can trust us to be who we say we are, to do what we say we're going to do. But integrity also deals with how we deal with ourselves, how we deal with our bodies and our minds. And I have to tell you, we're not doing well. Americans are virtually addicted to fats, salts, and sweets, and a sedentary lifestyle. Addicted. And so we each, first and foremost, have a responsibility to ourselves. Integrity demands that we make the best of the bodies and minds that we have been given. Yes, that we engage in regular physical activity, at least 5 days a week, 30 minutes a day at least, that we have in our diets an adequate amounts of fruits and vegetables, low-fat milk, whole-grain bread, and that we minimize the meats, fat, salts, and sweets. We have that responsibility. Integrity demands that we treat our bodies with that kind of respect. And yet in this country, we have a major problem. Much of the cost in our health system is to treat diseases that are preventable. In fact, 80% of the cost of Medicare is related to diseases that are preventable. They could have been prevented in the first place. We're not living up to our personal responsibilities for health. The second dimension of ethical leadership is civility, how we treat other people, whether we treat other people with respect. And I worked in the health system a long time, and I can tell you, unfortunately, it is a health system that does not treat a lot of people with respect, especially the poor and many minorities are not treated with respect in our health system. There are some cases in which when you go there for care, they don't even speak your language or they don't understand your culture. And of course, we force people to go to emergency room and to wait long hours in order to get care. So our system does not treat people with civility and respect. And that's what we have to overcome. But it also means that we as individuals have to treat other people with civility and respect. That's why smoking in public places should be outlawed, as it was first in California in 1987. It's interesting, in 2001, when I released the Surgeon General's report on women and smoking, California was the only state in the Union where lung cancer death was going down in women. Only state in the Union. And it had a lot to do with the fact that in 1987, California started to introduce legislation to prevent people from smoking in public places, which means a lot of people decided to quit smoking, or to be exposed to secondhand smoke. Finally, the third dimension of ethical leadership that's so critical to our health system is community. Each one of us has this community responsibility, the responsibility to do our part to make the community better, whether we're students at Morehouse College or whether we live in a community in California or Mississippi. We have the responsibility not just to ourselves, but to be good citizens and make our community better. President Obama has signed into legislation a major health reform act, the Patient Protection and Affordability Act. And it does several things that need to be done. It dramatically improves access. In fact, over the next few years, 32 million more people will have access to care. It focuses more attention on prevention, and it rewards prevention, and it rewards primary care. The legislation also creates a national prevention agenda, which the Surgeon General has just recently released in detail. But it says we're going to provide incentives for people to engage in healthy behaviors. Now, corporations like Johnson & Johnson have demonstrated that if you reward healthy behaviors, you can reduce dramatically the cost of care. Johnson & Johnson, in fact, reduced their cost of employee health care by over $100 million a year by rewarding healthy behaviors, physical activity, weight loss, stop smoking. And President Obama has the same idea. However, as you know, the legislation is under attack, and it has just been, I guess, accepted for review by the Supreme Court. And that has to make you nervous, given our Supreme Court today. But I have to say that whatever happens to this legislation in the Supreme Court, we have a responsibility to reform our health system. Reform it in terms of cost, access, quality, and to eliminate disparities in health. Well, let me leave you with the Surgeon General's prescription. There are 5 parts to it. I think we have about 200 down here, so if you have a chance to pick up one. But it has 5 parts. It does start with regular physical activity, and then nutrition, avoiding toxins such as tobacco and illicit drugs, being responsible in your sexual behavior. That gets back to both the integrity and the civility of our behavior, sexual behavior and being responsible. Yes, it's true. African Americans have the highest risk for HIV in this country. for other sexually transmitted diseases like syphilis. African American men are 7 times more likely to die of AIDS than their white counterparts. So the issue of responsible sexual behavior stands before us as a major challenge, not just for protecting ourselves, but for protecting others. Well, you know, there's a story about, and I'll close, there was a story about a Texas farmer who had a 5,000-acre farm, and he decided that he would travel across the South to look at other farms. So he stopped first in South Carolina, and he was sitting on the porch talking to a South Carolina farmer. And he said to the farmer, "How many acres of land do you have here?" The South Carolina farmer hadn't thought about that a lot, but he said, "Well, maybe 60 or 70 acres. And the Texas farmer thought to himself, "My goodness, my farm is so much bigger than this guy's, until if I told him how big it is, he wouldn't understand." So he said, I'll just give him an example. He said, "Sir, do you realize that there are several times when in the morning, just as the sun is coming up, I get in my truck and drive across my farm. And do you realize that by the time that the sun is going down, I still have not reached the end of my farm?" The South Carolina farmer thought about that a minute, and he said, "You know, I used to have a truck like that." Well, our healthcare system is big enough. It's big enough, but there's something wrong with the truck. And together, we've got to fix that truck. Leadership is like a relay race. And I ran a little track here at Morehouse, and I underlined little, but I always really admired the relay race. And as you probably remember, in the last Olympics, the United States 4x100 men and women team lost the relay race. And they lost it because they dropped the baton. Leadership is like a relay race. It doesn't matter how fast you run, you've got to make sure that you have the baton, that you pass the baton to the next generation, that it is received in such a way that no momentum is lost. So we're depending upon you to make sure that we continue to advance this baton, that healthcare in America and in the world continues to improve, starting with our individual behaviors. I still like to recite that poem that I first heard here in chapel, God's Minute. I have only just a minute, only 60 seconds in it. Forced upon me, can't refuse it. I didn't seek it, didn't choose it. Yet it's up to me to use it. I must suffer if I lose it, give account if I abuse it. Just a tiny little minute, and yet eternity is in it. Thank you.
Gentlemen, please remain as I present this token of our appreciation. Dr. Satcher, you have challenged us to live responsibly, to live lives of health and ethical integrity, and we appreciate your words of challenge to the Morehouse community. I'd like to present this token of our appreciation for your presence today. Thank you. Thank you, sir.
Let's give Dr. Satcher another round of applause. What a wonderful way to end the Crown Forum series of this semester. 2 quick things. Could I ask for 2 scanners to be in place down here to my right and to my left? And then we'll have scanners at the entrance door. We will not have a bottleneck. We'll do this efficiently today. Secondly, some of you have emailed me and said to me, you have had problems with the barcode on your ID card. We don't want you to fail, and you've been here, but it's no fault of your own. If there is a problem and you are in fear of failing, yet you've been here, as one email indicated to me, In the next week, because we're going to begin to compile Crown Forum grades, we have thousands of individual grades we've got to put together. Please come by 307 Gloucester Hall. My assistant, Mrs. Samantha Crouch, or I will have you to fill out a form indicating to us specifically that you're having a problem. You are men of integrity. You listened to Dr. Satcher today. We know you have ethos. And so we're going to take your word if you're having a problem. We're not going to question you and give you a very hard time because you are men of Morehouse and you have no reason to lie, because look what you get when you come into Crown Forum. So take care of that so you will not receive an F, and you've been here. And now no man of Morehouse should leave before locking arms with his brother and sing for one last time in this calendar year the college hymn before dismissal.
Make us steadfast